often known as during post-operative period. Post-operative phase is a period of time that begins with the admission of the patient to the post-anesthesia care unit and ends up after follow-up evaluation in the clinical setting or home. Post-anesthesia care units are located adjacent to the operating rooms. Immediate post-operative phase and the late post-operative phase. That is, in phase 1 PACU, immediate, and late post-operative phase is a phase 2 PACU. In phase 1 PACU that requires intense nursing care, phase 2 PACU would require less frequent observation. The surgeon decides whether to transfer to the post-anesthetic care unit, depending upon the condition of the patient. Normally, the patients get transferred to the post-anesthetic care unit for observation. Then only they get transferred either to ward or home, and even sometimes to intensive care unit. Nursing interventions to prevent post-operative complications. First, maintaining a patent airway. Corrective measures for preventing hypertension and shock. To prevent hemorrhage. To correct hypertension and dysarrhythmias. Then preventing respiratory complications.